Fibroids, you've probably heard the word before. Maybe from a friend, a sister, aunt, or even your doctor. And if you're African, you've definitely heard it. Because it seems like everyone knows someone dealing with fibroids. But what exactly are fibroids? Why do so many women have them? Why should you be worried if you're being told you have them? In today's video, I'm going to break it down in the simplest way possible. What fibroids are, why they happen, the symptoms, treatment options, most importantly, why so many women have them today. What are fibroids? Let's start with the basics. Fibroids are non-cancerous growths that develop in and around your uterus. That's the womb. The medical term is uterine leiomyoma. I know it sounds scary, but remember they are not cancers. Think of fibroids like little or sometimes not so little lumps made up of muscle and fibrous tissues. They can be small as a pea or large as a watermelon. Sometimes a woman can just have one. Other times she may have multiple fibroids growing at the same time. Now here's the part that shocks people, that shocks most people. Many women who have fibroids don't even know they do, because fibroids don't always cause symptoms. That's why you hear of so many women discovering them only during a routine checkup or pregnancy scan. Why do so many women have them? Here's the big question. Why are fibroids so common, especially among African women? The truth is, doctors don't know the exact cause. But here are the major factors we do know. Hormones. Fibroids are very sensitive to hormones, especially estrogen and progesterone. These are the same hormones that control your menstrual cycle. That's why fibroids tend to grow during reproductive years and often shrink after menopause. Genetics. If your mother or sister had fibroids, you're more likely to have them too. There is definitely a family link. Ethnicity. Studies show that black women are more likely to develop fibroids at a younger age compared to women of other races. Not only that, but fibroids tend to be larger and cause more symptoms. Obesity. Diet high in red meat, low in fruits and vegetables, alcohol intake, and even stress all be linked to fibroid growth. Delayed childbirth. In previous generations, women tended to have children earlier, and multiple pregnancies can actually reduce the risk of uterine fibroid. But today, many women are delaying childbirth for career, education, or personal reasons, which means more exposure to hormones, estrogen and progesterone, and a higher risk of fibroid. When you put these factors together, genetics, hormones, lifestyle, and delayed childbirth, it makes sense why fibroids are so common today. Now let's talk about how fibroids actually affect women. Some women may have no symptoms at all, but when symptoms do happen, they can be life-changing. The most common include heavy menstrual bleeding, periods that soak through your pad and last longer than 7 days, and may actually cause severe anemia, pelvic pain and pressure, especially when the fibroids are large. Frequent urination, because fibroids can press on the bladder. Constipation, if it puts pressure on the bowel. If they press on the bowel. Difficulty getting pregnant. Fibroids can sometimes interfere with fertility, depending on where they are located. So let's not forget the emotional toll. Imagine being in constant pain, bleeding heavily every month, or worrying about fertility. It's not just a physical issue. It affects mental health, relationships, and the quality of life. So, how do doctors diagnose fibroids? Most times, fibroids are discovered during a pelvic examination or an ultrasound scan. Ultrasound is the most common test. Sometimes an MRI might be used to see the exact size and location. Now for treatment. Good news is, not every woman with fibroids requires surgery. Not every woman with fibroids requires treatment. If you do have symptoms, doctors often just monitor the fibroids. But if you have symptoms, there are options. Medications, control heavy bleeding, or to shrink the fibroid temporarily. Minimal invasive procedures like uterine artery embolization, which cuts off blood supply to the fibroid. Surgery, options like myomectomy, removing the fibroids but preserving the uterus, or hysterectomy, removing the uterus. So, here's the bottom line. Fibroids are extremely common. In fact, studies suggest that up to 70 to 80% of women will have fibroids by the age of 50. But common does not mean hopeless. Many women live normal lives. Some never need treatment, and for those who do, modern medicine offers many options. If you or someone you know has fibroids, don't panic. Talk to your doctor, understand your options, and make the choice that's best for your body and your future. Now, I want to hear from you. You know someone dealing with fibroids? Share this video with someone. Or have you experienced it? Drop your story in the comment section below. Let's create awareness and support each other. Don't forget to like, comment, and of course subscribe to my YouTube channel. Subscribe for more Doctor Explain videos, health breakdowns in simple English.